Okay.
Okay, so we're live on the air now.
Live on the air, talking about varicocele healing.
Yeah, varicocele healing. So I guess we should just start on the topic of what is varicocele.
Yeah, that's something that confused me. What is varicocele exactly?
Okay, well, varicocele is really it's swollen testicle veins. It's when the blood doesn't circulate properly, it pools in the testicular veins, and that causes swelling, enlargement of the veins. And really, what the actual thing that really enlarges the veins isn't the blood pooling. It's because the testicles produce testosterone. The testosterone that's leaving the testicles pools in those veins a little bit, and then hypertrophies and increases the vein size.
Oh, swollen testicles.
Swollen veins.
Swollen veins. I'm sorry, swollen veins.
Yeah, the veins become swollen. If you have swollen testicles, that's actually a different condition entirely. That's called urchitis,
Okay.
and you need to see your doctor for that. That could be much more serious right now.
Okay. So how do we know, or how do we know to see a doctor to find out if we have varicocele? Like, what are some symptoms that people might experience?
Usually oftentimes varicocele can be symptomless.
Okay.
Right? And there's different grades of varicocele. You can have grade 1, 2, 3. Some people even say 4. Clinical, which is not, you can't even see it yourself. So sometimes you can not have any symptoms. Like a grade 1 varicocele, you might be able to, you don't have any symptoms, but if you press down, you exert, you might be able to feel some veins. A grade 2 varicocele is very similar. Grade 3 varicocele, normally when you're standing, you can see the veins, literally like varicose veins in the legs, in the calves.
Yeah.
You can literally see those. You can see the veins in the scrotum.
Wow. Okay.
And some people say it looks like a bag of worms. I think that's a little bit too scary for most people, having a bag of worms next. But that's not. You shouldn't really think of it like that. You should think of it more like it's just the blood's not circulating so well.
And you can physically feel as well, like if you were to touch in that area?
Grade 2 and grade 3 varicoceles you can feel.
Okay.
You can feel those.
Okay.
Usually you can feel them. Yeah. They're palpable.
So what's so bad about it anyway? I mean, what makes it a bad thing to have?
Well, varicocele is the #1 cause of male infertility. About 40-60% of cases of male infertility have varicocele. Actually, oftentimes people go in for male infertility because they can't achieve successful pregnancy, and they end up being diagnosed with varicocele.
Okay.
So it's a lot higher occurrence in people who have male infertility because of that specific. Because they go in and they're like, oh, okay, you actually have the condition. Let alone if the general population doesn't normally get that checked anyway. So it occurs in about 10-15% of the population. I think the consensus is 15% of men have it. Yeah.
Wow. Okay, that's a pretty big number. So I'm sure you've talked to people with this condition then.
Yeah, I've been doing this for over 4 years now, and I've personally communicated with over 6,000 clients who have varicocele, at least maybe even 9,000. And I've personally, through emails, through phone calls, I've contacted them, and I've actually helped thousands of people kind of get through this condition, which can be very serious and debilitating.
Speaking of that, I mean, what kind of solutions are there for varicocele? I mean, is it treatable? Is there a cure? Like, what can people do about it if they have it?
Well, I think it's better to kind of step back for a second and kind of realize, okay, so what symptoms do you have, right? If you have no symptoms, you got to realize sometimes what happens is that the varicocele symptoms do develop. And it's a chronic condition. It doesn't really go away by itself, and it worsens over time, right? So it's important to do something about it as soon as possible, right? Why is it bad? Varicocele, it can cause pain. It can cause infertility. It can lower your testosterone. It can even cause testicular shrinkage, right? And that's terrible, and that's why it needs to be treated, because it can become a serious condition even if it's not right now. And that's really the reality. The solutions right now, if you go to your doctor is going to give you kind of the same spiel. They give the same spiel to everyone. They say surgery. If it's really serious, they tell you to have surgery. Or if it's not serious and you have a bad doctor, that bad doctor tells you have surgery.
Right.
Right. Or they tell you have embolization, which is kind of like a crappy, sloppy version of surgery. It doesn't really, surgery cuts out the veins, right, that are swollen. So you're kind of left with the veins that weren't swollen, tried to take up all of the circulation for the ones that you just cut out. So you might be left with one. They try to normally spare 1 or 2 veins, but you're getting rid of the veins. So it's not really a cure, right? You got to kind of realize that that's not a cure. And then there's embolization, where they put coils. So it's kind of, but you can't target specific veins with coils, right? You're putting an embolus to block veins, so you block a general area, and you hope that you target most of the swollen veins in that area. And oftentimes there's these, like a lot of times varicocele redevelops after embolization, and we're talking about 15 to 30% recurrence rate after embolization, and I think that's ridiculous. Right.
Wow, they got to get that guarantee, man. They gotta...
Right. Yeah. There's, what's kind of stupid. They don't. You go into surgery, and the benefits, they're not guaranteed.
Right.
The risks, they're very possible, and usually, you have to kind of bear those.
Yeah.
Right. There's no warranty. It's not like you can get your money back. The surgeon fucks you up for life.
Right.
You don't necessarily get your money back, and they don't guarantee any results.
Wow.
Sounds like a con to me, right?
It does, yeah.
I think I'm pretty adamant that this type of procedure is not the best, for varicocele. Surgery, embolization, they're really not the best. And then you have medication. Medication usually is for temporary pain relief, temporary swelling relief. Swelling would be like they assume your varicocele is swollen because of inflammation. Right. Well, obviously, there's also medication, antibiotics for specifically if you have an infection, but that's a different story. That's not varicocele. That's a different condition entirely. So you got to realize that. And there's some medication that might help with fertility, but they might have symptoms, and they're not necessarily the most effective either. So usually medications for temporary relief. That's really the consensus. And then you have herbs, supplements, and there's some companies out there like Grow Care India. There's one called Dollyham's Health, and then there's another guy on YouTube. He's called Testosterone something. They're all pushing their supplements, and they're calling supplements as a cure for varicocele, and
there's no cure.
There's no 100% cure. Yeah, there's no cure, and quick fix, magic pill gimmicks. Right. There is no quick fix for it, right? And my treatments specifically, they're not a cure, and they're not a quick fix.
Okay.
Actually, they take time. Natural treatments, as I call them, they're specific at-home treatments. They're specific lifestyle changes that you can make. They're specific exercises you can do. It's about learning proper testicular care and treating varicocele toxic blood pooling.
So it sounds like it's more of a lifestyle as opposed to some kind of magic pill or some kind of surgery.
Yeah, well, why is it that surgery doesn't get you back to the normal baseline, right?
Yeah.
Why is it that it doesn't get you back to the normal baseline? The fact is that the number needed to treat for surgery, the NNT, and you can look this up, is 7 to 17. That means 6 to 14% improvement. That means for every 7 men who undergo surgery, the NNT being 7, only 1 additional successful pregnancy is attained. Only 1 for every 7. So you're going in there assuming you're curing your varicocele, but you might go from a natural, if you're infertile, there's a natural conception rate of 34%.
Right.
Right. So over a year, if you're infertile and you keep trying to have a successful pregnancy, some people still have successful pregnancy even though they're infertile. Right. That's around 34%. If you have surgery as a man, that increases the chance of successful pregnancy from 34% to 36 or 37%. So, and then you're risking permanent pain, right? You're risking your varicocele redeveloping. You're risking scarring. You're risking losing a testicle, which is actually one of the worst things. There's a 1% chance that you're going to read that supplies blood to the testicle, and you're going to lose that testicle because they cut it. You're risking permanent erectile dysfunctions.
Wow. Okay.
Right. So and the list goes on, and you don't hear about the entire list. On my website, I went through dozens and dozens and dozens of scientific articles, and I summarized in a table. It turned out to be a really giant table, all of the risk of varicocele surgery and embolization. And the list just keeps going on and on because, one person might not have the same symptom or same risk as you, right? And the chances of you suffering from a negative side effect is accurate than attaining in bed. So it's not a good procedure.
Oh, that seems to be best option on the surface for people.
Yeah. So they say. So when you go to your doctor, they're going to tell you, okay, surgery, or take these medications for temporary relief, temporary pain, temporary inflammation. Oftentimes, the medication might give you a little bit of relief, not too much, right after you get off the medication. And the medication might actually worsen your symptoms because one of the controllable varicocele risk factors is bowel health, and they give you Advil. And for a large percentage of people, Advil irritates their stomach, right? So that irritates your bowel health, your stomach, and that pressurizes the blood from being able to come back up because that's the risk factor for varicocele. And now you have your symptoms worsening, but because the medication is kind of counteracting the pain, right, or it's counteracting the inflammation a little bit, when you get off it, then you have increased pain, which is kind of ridiculous, if you ask me. So I think do nothing or temporary relief medications, that's not, right? So, it's not really the option. It's not really something you should do.
And those are the options that people are given.
That's what your doctor is going to give you when you go to them. And that, I've gone, like I said, I've spoken with maybe even 10,000 people now, and 10,000 men with varicocele. And, that's what they get, unfortunately.
A little bit about your story and about how you came
my story.
To learn more about varicocele.
Okay. So I actually, when I was young, actually, I had varicocele myself. I still have it, but, now it's so minor, it doesn't bother me at all. But I first noticed, I realized that I had varicocele when I was probably, my left testicle was more swollen. It was a little bit hanging lower. And normally it happens during puberty. 11 to 13 years old, around that age is when it kind of develops because the blood circulation to the testicles increases. So it increases your risks of developing varicocele. And this is like when you have other risk factors as well. Like kids are forced to sit down for many hours during the day. Yeah. Kids start masturbating. Kids, right? This is a reality, and they're sitting down while masturbating the whole time, right? We're watching porn these days. That's just natural. That's how it is these days. And you have many other risk factors that happen around the same time. And we're introduced to terrible diet. We go to school and our cafeterias serve us crap food. Right. And, it's kind of we're just bombarded by risk factors around that time. And that's just a reality. So I had varicocele around earliest I can remember. It was 11 years old. And then I remember just being embarrassed when I went into gym change rooms, or when I was 13 years old, when I went to my first gym change room, and And it's just embarrassing, just because one hangs lower, like, you just don't feel comfortable. And a lot of my clients can definitely relate to that. And then later, when I was 18, 19, university, I started developing some pain. I had started exercising heavy, and the stress of just having schoolwork, just everything just piling up. I started developing pain, and what happened was, I started looking for. I started being like, hey, there's something actually there, right? I didn't know it was there before. I just thought like one of my testicles hung lower, and I started looking for, okay, what the hell is this? I was like, oh shit, there's a lump of worms in my testicle. So I went on Google, and I found out I had varicocele. I was like, oh shit. And everyone said it's a genetic disorder. It's this number one cause of male infertility. It's terrible. So I was like, shit, I need to get this solved as soon as possible. And I looked for solutions on Google. And at this time, this was a long time ago, right? This was when Google first came out, and the results didn't come up. Just basically said faulty valve disorder, and surgery is the only option. So I went into my doctor. I was like, okay, I'll just get surgery. It's not a big deal, right? And then my doctor, she saw it, and she said, well, this isn't the biggest varicocele I've seen. And I was like, okay, that makes nothing better, right?
Right, yeah.
That doesn't do anything for me. And so what happened was, she said she had seen one that was bigger. I was like, and she said it was like freaking gargantuous. I was like, what? Why would that make me feel better?
Like that's somehow comforting you right? Or something.
And then she recommended me to a urologist, which is a doctor for
your area.
Your area, yeah.
Okay.
And what happened was, I went in, and I was lucky because I went to a good urologist. He told me, look, I'm not going to operate on you unless you really, really, really are adamant about it. Look, there's a chance that you're going to lose your testicles. There's a chance it's not going to work. There's risks. And as soon as actually he said, there's a chance that you're going to lose your testicle, I was like, no way I'm going to do that. Yeah. Like, it's pain. I'm just going to bear with it. So I did. And after 3 years later, maybe around 3 years later, the pain was just unbearable. The swelling got worse. It just terrible, just horrible experience, and just terrible experience. And I was, I went online, started looking for solutions, and there really wasn't any, And eventually, I kind of tried to forget about it, but I had to do something about it. And as I grew older, I started getting into health, fitness. I became a personal trainer, started doing yoga, started doing different types of things that were healthy, and completely changed my lifestyle around and everything. And being in the field, I just took it upon myself to treat it. I said, no matter what happens, I just decided, no matter what happens, I'm going to treat this. I don't care. I just decided, look, it's possible to treat. Even though everything said otherwise, I was just like, I'm just going to treat it. There's a crappy book by this guy named Robert Melanie, and it was called like Varicocele Natural Treatment Without Surgery or something like that.
Okay. And
it cost $32 and $39, and I bought it. I was just like, okay, it's just $39. Who cares? I'm gonna do whatever it takes to kind of treat this condition. The pain's unbearable. It's ridiculous. My left testicle had shrunken a little bit. It's terrible, terrible, terrible experience. So I went for a solution, and Robert Melanie's book, different results than Google search. On Google at that time, it was like, okay, take these supplements, just make a dietary changes, just like simple things that didn't really do actually anything or much.
Okay.
Right. But in Robert Melanie's book, there was one thing that kind of caught my attention. It was called like, and doing yoga inversions it helps. It's when you're laying back and your legs are up on higher than your hips, or your hips are above your torso, so the blood kind of naturally circulates back down. Okay. Towards your heart with the aid of gravity. Right. Right, and that makes sense. When you lay down with varicocele, the veins swelling goes away because it doesn't have to fight gravity anymore.
Oh, okay.
Right? So he said, do this all night. And he gave like this specific little guideline. And, it worked a little bit. And that, like, getting that little bit of like positive result,
Right.
I was like, it's possible.
Yeah.
So I just, I did so much freaking research. I tested. It's been, since then, I think it's been maybe 6 years now. I've done so much research. I literally I've read every single thing that existed on varicocele, natural treatment. And, right now we're on the 4th edition of the guide. The 5th edition is about to come out. And, the treatments are so much better than just completely different. I get clients literally messaging me every day and they're telling me results. Thank you so much. Look, I stopped exercising and now I'm exercising again because exercising aggravated. Look, I can't even sit at work. Some people quit their jobs because they can't sit down because of the pain. Isn't that crazy?
That's insane. So you're saying that this is something that caused people so much pain that they weren't able to work like they usually would, and they weren't able to exercise.
Yeah.
And I'm sure even intercourse was difficult as well.
Yeah, some people have lots of pain during and after intercourse, which sucks. Yeah, so this is a condition that affects your entire life, and it's a serious one. It's a serious one, that's for sure.
Okay, all right. So for people who suspect that they have varicocele, what's the next step for them?
Well, if you suspect that you have varicocele, first you have to go and confirm it, right?
Okay.
Right? You need an accurate diagnosis, and I tell this to every single person that messages me. If you haven't gotten proper diagnosis from your doctor, there's a lot of other conditions that can look similar. You could have epididymitis or orchitis. It could be a number of things. It could even be like cancer. That's kind of impeding. It could be anything to do with your bowel health or something going on in your digestive area that's impeding the blood circulation back up. So there could be lots of different things. So first, you go and you get checked by your doctor, get an accurate diagnosis. Then from there, okay, what are the treatment options, right? If you have varicocele, what are the treatment options? Is surgery an option? We covered that. I don't think it's an option. I think surgery sucks. Is that because I sell natural treatments? I've actually literally read over 1,000 scientific publications on this, and the facts say that one of the most controversial topics in the field of andrology.
Wow.
And that's just a fact. Some scientific meta-analysis, surgery might not be effective at all. Like, not more effective than just observing. Like, instead of going to, there's a funny publication I just posted on Facebook today. It said going in for fertility counseling benefits as varicocele surgery. Isn't that funny?
That's
funny, right? That's insane. I've also read other scientific publications. Acupuncture has better benefit for fertility than surgery. Yeah.
Wow.
Isn't that insane?
That's insane. And yet it's usually the number one option that doctors recommend.
Yeah. Cooling your testicles, for example, has better fertility benefits than surgery. These are the things you can do. You have lots of options, and that's the reality. You have lots of options. Don't limit yourself to surgery versus embolization. Don't limit yourself to surgery or doing nothing. Right?
Yeah.
You need to do something. That's the reality. Right?
I agree. Yeah.
Yeah, and it makes sense. There's lots of things that you can do. And in my healing guide, I just cover what are all of the things that you can do. And I kind of try to present that in the best possible way. Right? What are all of your options? And I've had so far, and if you just look at the reviews on my website or on Amazon, results say everything.
So, speaking of which, you said that you're onto the 5th edition of your book now.
I'm working on the 5th edition. It will be out soon. It's just I'm trying to make it really, really good. I don't want to let out crappy anything crappy for you guys. I want to make sure that the presentation is there. Like I said, I'm personally talking with clients every single day. At least a dozen clients every single day I'm talking with. And I know what's wrong with the fourth edition. The fourth edition, the organization isn't perfect. You know, the recommendations, some of the recommendations suck. Recommendations are really good, but some people are following the sucky recommendations. So that's why the fifth edition needs to come out, because I need to give you guys the best.
So you're continually updating your content.
Yeah, and if you get the ebook, you know, I'll give you the fifth edition free of charge. You get the fourth edition now, I'll give you the fifth edition free of charge. If you get the fifth edition, I'll give you the sixth edition free of charge. You know, if you have the fourth edition, I'll give you the sixth edition free of charge. I don't care. You know, I want you guys to have the best treatment options, and that's the reality.
Yeah.
Just make sure, like, I want natural treatment to be an option for natural treatment. Treatments at home, things you can do, what you can do. You know, don't focus on surgery or nothing. You can do, and that's the reality. And you know, the results, again, the results say everything. Just if you won't take, I used to have a massive grade 3 varicocele. It's almost always no longer visible. I used to have tons of pain. Zero pain. You know, zero pain. You know, this is a condition they say it's chronic, it's forever, you can't do anything about. But here I am, and here are thousands of my clients who have gotten great results, right? And it's just the reality. The reality and the results just say everything. If, like, go ahead, spend $10,000, $14,000, $20,000 on surgery without doing your research and realizing, look, the results suck. If you don't do your, you know, you listen to the doctor, high success rate, they say surgery has a very high success rate. Success in finishing the procedure. Yeah, the procedure finished without them fucking you up is basically what that means.
That's a success.
That's success. Success isn't measured by pregnancy rates, right? Infertile couples go in, they're trying to have kids, and then these guys say there's a high success rate. High success rate for who? For the surgeon? It makes no sense, right?
Yeah, I agree. Doesn't make much sense.
Yeah, the pregnancy rate, like we said, the pregnancy rate, there's a number needed to treat. And this is pretty firm. This is not that question. It's either not effective at all, surgery is not effective at all, or the number needed to treat is 7. Chances of conceiving, it increases for 1 in 7 men who undergo surgery, 1 attains a successful pregnancy. And that's the highest, that's the best results for surgery. That's the best. We're talking about the best publications are, like, you know, sometimes, you know, if you do statistics, there's going to be some variation, right?
Right.
So the variation, when you look at the best stuff and you say, okay, surgery works, you know, the NNT is 7. And then we have some publications that say NNT is 17, right? And then we have lots of publications that say that it's not effective at all. So, you know, and if there's specific things you have to follow as well. If your spouse, if your wife is not fertile and you have varicocele, the odds of you're having varicocelectomy, which is varicocele surgery, the odds of that leading to successful pregnancy is so much lower because your wife. Right?
Yeah.
You know, there's so much other factors you have to consider, and people just go in and blindly, ignorantly just accept that surgery is a cure for their condition. It's not. It's far from being a cure.
Okay. So since this is something that you're not able to cure, the that you offer.
Yeah, they're not a cure either. Yeah, sorry guys.
So
I don't come bearing a cure today. Sorry guys.
So would this be something that people would practice continually? It would be like a lifestyle, or just something that you do for a set period of time, or?
Yeah.
Okay.
You know, yeah, it's lifestyle changes. You know.
Okay.
And the great thing about lifestyle changes is, like, if you're wearing crappy underwear, for example, that's traps heat, irritating your varicocele, which is often the case, If you're wearing a crappy underwear, you just change the underwear. You know, that takes 5 minutes or 10 minutes to purchase, right?
Right.
But then, you know, you don't have to worry about it again.
Yeah.
Right.
Yeah.
That's the reality. It's a lifestyle change. You change it, it's done. It's not some things, you know, there's some risk factors you have to kind of control every day. But, you know, if you follow my recommendations, you won't consider varicocele even a problem for the rest of your life, really. And I've had lots and lots of clients confirm it. Obviously, results vary, obviously, but that's just the reality. Some people, like, I've had some clients come to me, they have like infections. They pretend like they have varicocele, but they have an infection and their pain starts getting worse and they start blaming me. I'm like, dude, if your pain is getting worse, you don't have a varicocele. That's not how it works.
Right.
Right. Varicocele usually has dull, aching, long kind of duration, dragging, weighing down, feeling pain. It's not, if you have a sharp shooting pain, that's usually not varicocele. Sometimes it is, but that's rare.
And that goes right back to what you said earlier about go see a doctor.
Yeah, so you gotta see a doctor first and foremost. You gotta get an accurate diagnosis. You pretend like you know exactly what's going on, but you never know.
Yeah, we
exactly.
Self-diagnose.
Yeah.
All right, so something practical. Give me a couple of easy wins for some people with varicocele. What could they do right now?
You want to give them some tips, huh?
Yeah. Give me a couple tips here.
Okay, look. So varicocele is pooled blood. What happens is the veins it's called the pampiniform plexus. Those veins, when those veins become swollen, you gotta realize these veins are responsible for cooling your testicles, right? So when the blood pools in them, the counter current heat exchange mechanism, whatever that's going on, it doesn't function properly. So the testicles, they heat up to the same temperature as the body or even hotter, right? So varicocele disrupts and breaks down proper testicular heat regulation, right? So often what happens is with varicocele, you have testicular overheating. So if you have a varicocele, look, you've got to perform cooling treatments every day. That's just how it goes. So a cooling treatment is, for example, you run cool water after you exercise, for example. Take a cold shower, right? Run cold water over your entire body, take a cold shower. It doesn't have to be cold, it can be cool, you know? Something bearable is fine, as long as it's below your normal body temperature. If it feels a little bit cool, that's good enough. Run cool water over your testicles for 5, 10, 15 seconds. Don't overcool, but cool them down, right? Especially after exercise. Exercising, you're wearing underwear typically that sucks and traps lots of heat. You're cotton underwear that's supposed to be breathable, which is not. You're wearing your briefs, right? You're wearing your briefs that kind of prevent your testicles from even dropping down to cool, right? Look, there's a reason why your testicles are outside your body, right? Right?
Yeah, it's true.
It's just a reality. Like, they're supposed to be kept cool. Reason for you to keep your entire genetic inheritance outside of your body and in a risky place that's painful if it's hit, right? It just doesn't make any sense. And a lot of mammals actually have their testicles in their abdomen, right? And that abdominal area is still kept cool, right? So there's obvious reasons. If you study biology, the sperm DNA, you want the cell proliferation to be at a slower rate, right? For your gametes, for your sperm. Well, not getting too technical, but your testicles to overheat because that causes DNA damage. Is the summary.
Okay.
Right?
Okay.
And you don't want your testicles to be too overheated because what happens is your testicles have enzymes and proteins that only function at a certain temperature. I know it's probably too much. It's too much testicle talk for you guys, So let's just get to you need to cool your testicles.
Keep them cool.
Keep them cool.
Okay.
That might also mean changing that crappy underwear you're wearing. That might mean taking a little bit extra precaution after exercise. That might mean.
So pause for a second.
Yeah.
Speaking of the underwear.
Yeah.
Are we talking about boxers, briefs? Are we talking about doing without it? Are we wearing skirts? What are we talking about?
They all kind of suck.
Okay.
It's super, super difficult for men these days to find proper underwear for varicocele, for their testicles, actually, in general. Most underwear suck. Boxers better than briefs. Briefs, probably most people need to stay away from. Actually, that's one more thing that your doctor might have recommended to you. Wear supporters. Wear supporters, they say. But the problem is, most supporters, what happens is they cause overheating of your testicle, and they stop your testicles from dropping down to cool, right? So that causes more pain, right? So if you want proper testicular support underwear, it needs to be breathable. If you want compression, it needs to come with breathability. We're making the varicocele therapeutic underwear, right? That's still in the process, but it might be out by the time you're listening to this. And we're mixing the most breathable fabric that you could possibly find for underwear with compression. And we're separating the penis and the scrotum. So that's pretty natural. You don't want to wear underwear like briefs that kind of squish everything into one lump, right?
Yeah.
Heat, right? There's a reason why they're separate. Let's keep them separate, right?
Right.
And that makes a huge difference. I've tested it out, and it's great. It really, this is gonna be a massive game changer. Add that to the healing guide, the varicocele therapeutic underwear, and the complete guide to natural healing of varicocele, and you're golden. I promise you won't have to worry about varicocele ever again. That's really how it is.
Wow. Okay.
I have the solutions that you need.
So, running through those quick, easy wins.
Yeah.
Cooling your testicles.
Cooling your testicles. Change that underwear to a better one.
Okay. Awesome. Yeah. Keep them cool.
Keep them cool.
Run some cool water over it for about 10 to 15 seconds.
10 to 15 seconds. Yeah.
Swap out your underwear.
Yeah.
Boxers, briefs, no good.
Yeah, they're not. They both suck. Boxers are better than briefs, and going commando sometimes is actually better than either one, than either boxers or briefs. Major problems is testicular overheating, so you gotta keep them cool. That's just how it goes.
I like that advice. I'm gonna start sleeping commando.
That's actually that's a great tip.
Really?
You should sleep commando. Yeah.
Is it in the book?
It's in the book. Yeah, that's in the book. You should sleep commando. Keep it cool at night. Keep it cool during the day.
Nice.
And a lot of people who sit down for work all the time, that's a major risk factor. That's a major risk factor. And pain, not all of you. I know only about 40% of men who have varicocele have pain. A lot of you are sitting down and your pain is increasing, right? And, often you're working or traveling to work, right? So you can't stop sitting. And I cover exactly what you need to do to treat that in the book.
Wow, sounds awesome. Sounds like you got a lot of tips in there.
From exercising, work, from daily living, every single thing that you need to know about varicocele, and just living with it and making it no longer a problem. That's the goal with the book. And every single thing you need to know is covered. And if it's not in there, just message me, info@varicocelehealing.com, and I'll personally help you and write you a page of content on whatever your problem is. And I've been doing that for 9,000 clients, so it's not a problem if I do it for 9,001.
All right, so where can we pick up the book?
Go to varicocelehealing.com. You'll find it's not too hard to find from there. It's also on Amazon, by the way. Those are two ways. I also have a yoga video series. Turns out yoga is actually very beneficial for varicocele because it really helps circulate the blood better. and helps cool the testicles down. It also helps treat a lot of the specific things from sitting down too much that are risk factors, like postural problems, tight muscles, specific things like that. So yoga turns out to be very beneficial, which I was kind of surprised. But my clients who started the yoga video series, they like it a lot. It's gotten them great benefits. It's not the best right now, but I'm updating it, and it gets good results. That's what matters.
Awesome results.
Yeah, results.
Natural treatments over surgery.
Yeah, and don't fall for the supplements, quick fix, magic pill gimmicks. I'm just gonna go over this point again because it's really important. There's a couple companies and they're selling supplements for $500 to $1,000 supplements. These are just like simple like herbs and shit, and they're selling for $1,000, $600 to $1,000 USD, United States dollars, right? We're talking about heavy money for supplements, and they're selling it as cures. I've been to their websites. They're saying it's a cure. Like a lot of you guys might find a website called Grow Care India or Dolly Ham's Health, which is a Nigerian company. And websites is that, supplements will not cure varicocele. Simple as that. They will barely even give you good results. Actually, they're so minor a part of the natural treatment process that in my book I say, look, don't focus on supplements, right? Instead, focus on the lifestyle changes, focus on the things that you can do, and then maybe pick up a supplement, specific ones, not the ones these guys recommend. Pick up a supplement and that might help a little bit, right? But only after you've done the lifestyle changes. If you don't do the lifestyle changes, the supplements are useless.
Do you recommend some in the book?
I do have a couple of supplements that I recommend,
okay.
But in the 5th edition, because some people you guys just want quick fix magic pill gimmicks for some reason really badly. I keep having clients message me. They say, I bought every single supplement in your book. I'm like, I told you in the book not to buy every supplement, right? Yeah. They buy like 7 different supplements. I don't know. They want to like kill themselves or something. I don't know what's going on. And they tell me, okay, so what do I do with them? I'm like, don't take them, right? Start with what's in the book, and then maybe add a little bit of supplements, right? I'm personally making a supplement just because I want to underprice these guys. That's really it. I'm gonna underprice these guys. I'm gonna sell it for like 1/10 the price because that's really how much it should be. So. Does it help? A little bit, but don't focus on that. Focus on the lifestyle changes and everything else, like the 100 other things you can do, right?
And then once you've done that, supplement that.
And then supplement that, yeah.
With a supplement, yeah.
Or maybe don't supplement it at all,
right?
Because you might be fine by that time.
Makes sense.
Yeah, that's how it goes. Anything else? If you want to talk about it, just a personal story about surgery. I told you this story earlier, remember? Surgery. So yeah. I get lots of clients, and some countries are very terrible for surgery, over prescribing surgery.
Okay.
Like India, Nigeria, these countries, they just you go in and you have a grade 1 varicocele, which is minor, right? It's a minor condition, but they make you feel like you're gonna die. And they prescribe you surgery, and this happens all the time. And I had a client, a boy. He wasn't even a man. He was 19 years old, a 19-year-old boy. And I need help. I've undergone 2 surgeries and 1 embolization, and I have really bad chronic pain.
After all that,
I'm thinking like this guy. He said his testicle is shrinking, and he has hydrocele, which is a condition where fluid builds up in the scrotal sac next to the testicles. And I said, look, there might not be much that I can do. My treatments have helped people who have had surgery and have symptoms that remain. Like my treatments do help with that because I treat the root cause of varicocele. But I told him, look, the reality is you probably have suffered from real damage from surgery and embolization, right? And this damage can be permanent, right? And that's the reality. And you know what I did for him? I just said, look, here's the healing guide for free. Here's the yoga series for free. Here's, if you have any questions, let me know. He didn't message me after that. He never messaged me after that. But, I felt so bad and irritated and angry after that because it's just so overprescribed sometimes. And in the United States and Canada, we just don't do that kind of stuff. Usually.
Right, yeah, usually. Yeah.
Sometimes we do. Sometimes you go to the wrong urologist. He's like, yeah, you have a little bit of mild pain. Yeah, have surgery. It will cure it, even though there's no real evidence, scientifically speaking, that surgery is effective for pain relief. The evidence is so lacking. I think there's so little scientific publication on varicocele pain and surgery. It's mind-boggling that it's prescribed for varicocele pain in the first place. It's mind-boggling. It's crazy. It makes no sense.
So you're saying then,
yeah,
before you go to surgery,
yeah,
stop, try some of these tips.
Try some of these maybe I can't say that specifically because it might be giving medical advice and then I might get into shit, right? But saying that, I think I'm disclosed enough and saying that, look, I'm not a doctor, but the results say everything, right? And I've helped so many clients so far. I think I have authority. I've been doing this for so long. I've probably read many more scientific publications than most of the people you're seeing, right? And I've spoken with so many clients, and the results again say everything. So yeah. Try the natural at home, natural treatments, lifestyle changes, proper testicular care before you go into surgery. It makes sense. I'm not charging much for this stuff. It's $39 for the book. For $39 versus $14,000 is the average cost of surgery right now in the United States. Just try.
Yeah.
Just try them.
What's the worst that can happen?
You might lose $40, but no, you won't lose $40 because you can always ask for your money back because I give a 90-day money back guarantee, which I uphold. No questions asked, no bullshit. I won't even have any hard feelings because, I know it works. And if it doesn't work for you, look, you probably have another condition, man. Right? That's just the reality. It's like, it's proper testicular care. If you don't take good care of your testicles, which none of us are taught, were you taught proper testicular care?
No, I didn't even know it was a thing.
I guess it wasn't until I came around, right? So it works, and you should get started now because, like I said, you wait and you wait and you wait. Find me again. That's the reality, right? If you don't find me again, look, what are the other options? What are the alternatives? Right? Are you going to have surgery? Are you going to go for supplements? I know of no one else who's doing natural, like properly taking care of men who have varicocele, right? Who's doing that? No one's, well, a few people are. I know like some acupuncturists, there's some holistic therapists, but they don't know what I know. I've been doing this for a long time. I'm very focused and I've gotten great results. It's just the reality. So is there anything else we want to talk about today? I don't know. Let's take a 5-minute break, come back.
Sure thing.
Yeah?
Yeah.
And if you guys have any questions, if anyone's in this live stream right now, if you have any questions at all, leave it and I'll respond.